Hi, what's up, guys? Today we're gonna review on reviewed data on the patient's record. All right. So let's get started. So which of the following can be used to estimate your HCT? So what's HCT stand for? That stand for hematocrit. All right, the hematocrit and hemoglobin always goes together. Remember that it's age and age. Whenever you go come up to the patient, you always got ask them what's you're always gonna find out what's their age and age. They always go together. They're like twins. Okay, so HCT and hemoglobin. All right, this is the answer right here. They always go together. So remember the age and age. All right, so we're gonna click hemoglobin. But before you click that, you also look to the other answer. All right, don't just like jump to the gun that oh I want this, I want this. No, you want to do the process of elimination. So if you don't know what it is, like this met hemoglobin, if you don't know what the hell it is, don't pick it. All right, leukocyte count, no. So that's hemoglobin, right? That's the right answer. Let's move on. So which of the following can be used to estimate level of hemoglobin? Like I said, it's gonna be the hematocrit and gonna be your this one. That's for asthma. RHB, you never heard of that? Don't pick it. So it's gonna be your RBC and hematocrit. So they always go together. RBC and H and H. So you pick 3 and 4. All right. So what is the difference between diastolic portion of the PAP and the mean PCWP pressure? So you want to find out the difference between those two. All right. So that's 0 to 4. Alright, we're going to do this interpretation right here. So a patient has pulmonary artery catheter in place. The following data is obtained. So now what you want to do here is whatever is from high to low or from high to normal, that's where the disease at. If it is low, 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 it's low, 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 that's pretty much shock, right? If it is high, 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 that's just pretty much overloaded, high, hypervolemic. So now we're gonna check. This one you're gonna know your norms. The CBP is 2 to 6, so that's low. Okay, and then you're gonna go to your PAP, which is 14. All right, but that one is kind of low. And then your PCWP, which is about 8, 7 to 9. So that is low. And guys, the cardiac index, don't get mixed up with the cardiac output. Because the cardiac index is half of cardiac output. Cardiac output is 4 to 8. And then you want to do the half of that. It's still not going to meet the 2 to 5 or 2 to 4, right? That's one point. So everything here is low. So now, like what I said, hyper, that's not going to cut it, right? Hyper, there's a lot. So increase left side preloaded, no. Increase PBR. So this one is decrease right atrial filling pressure. Okay, a patient has a pulmonary artery catheter in place. The dichrotic match is visible on PA waveform. The following data is obtained. Like what I said, you gotta know your norms. So this one 2 to 6 CBP is high. After the CBP, you want to do your PAP, which is the minimum is 14, but that one is way up there, so that is high. Then you're gonna do your PCWP, which is 12. The norm is 8. That is high. and then it went back to normal. So like what I said is from high to normal, from high to low, that's where the disease at. So the disease is right here to your, this is gonna be your right, your left side of the heart. So that's gonna be it, it can't be hyperbulimia because hyper. So let's do it one by one. Hyperbulimia, everything gonna be high. So it is a pulmonary hypertension. No. Hypobulimia is gonna be everything low. So the only we leave you at is a CHF. Okay. Let's do one more so you won't get bored. So a patient has a pulmonary artery catheter in place. The necrotic notch is visible to the PA waveform. The following data is obtained. So let's do the hemodynamics again. The CBP is 5. The normal is 2 to 6. That is normal. Let's do the PAP. Oops, it went up. It's high now. Because the normal is 14, so it went up to 23. So watch out for the high. Watch out from high to low or high to norm. That's where the disease is at. So let's go to PCWP. So this one is 14, right? 8. PCW normal is 8. So that's still high. So you good at that. And then it dropped right here. Okay, cardiac index, that's supposed to be 2 to 5, for 2 to 4. So it dropped right here. That means the disease is on your right heart, right side of your heart. So now the disease you're gonna look at is your right-sided heart disease, which is CHF or mitral valve stenosis. So like hyperbulimia can be hyperbulimia. Everything is hot. Pulmonary, that's going to be right-sided. So right there, that would be the CHF, which is congestive heart failure. Hypovolemic can be everything going to be down. So that would leave you with letter C. So that's it for now, guys. Please subscribe for weekly updates. I'm going to do a weekly tutorial in here. We're going to do subject by subject area. So if you feel like this subject is your weakness, we could go on through, leave your comments, and talk to you guys later.